Today's topic is diuretics. So what is diuretics? Diuretics are the substances. It increases the urine output. It's mainly acting on our kidney. So diuretics are the substances. It's a loss of sodium and water through the urine. It's preferably acting on our kidney. So next. Preferably it's acting on nephron. So the nephron is consisting of these parts, mainly glomerulus. The filtration process is occur in the glomerulus part. Next it's a loop of Henle, ascending loop of Henle, descending loop of Henle. Next there is a proximal convoluted tubule, distal convoluted tubule. Next is a collecting ducts. So again we classify diuretics according to the site of action. The drugs acting on the loop of Henle, that's we called as mainly high ceiling diuretics. That's a loop furosemide. Diazide-like diuretics, carbonic anhydrase inhibitors, potassium sparing diuretic, osmotic diuretic, and low ceiling diuretics. This is the one type of classification according to the action. Again, we classified according to the site of action. The drugs that acting on proximal convoluted tubule, drugs acting on loop of Henle, and drugs acting on distal and connecting ducts. There are three type of classification. One depending upon the mechanism of action. Next, it's depending upon the chemical classification. Another one, it's depending upon the site of action. So next, so it is a medium efficacy diuretics. So mainly there's a diazide diuretic. Example that a hydrochlorothiazide, chlorothiazide, diazide diuretics, diazide-like diuretics. It is a metalosome. Next. So weak diuretics, carbonic anhydrase inhibitor, acetazolamide, potassium sparing diuretics, spironolactone. There is a renal epithelium sodium channel mainly. There is amiloride, osmotic diuretic mannitol, and xanthan derivatives, theophylline. This is a classification. Next, the mechanism of action. The primary drug is furosemide. It's coming in a loop diuretic. The main mechanism of action of loop diuretic is it's mainly prevent the reabsorption part of sodium chloride and sodium ions. It's preferably acting on loop. That's why it's called as loop diuretic. It's prevent the sodium. It's mainly block sodium chloride and potassium symport. So these ions are not reabsorbed by our renal tubule. It's excreted through urine. So it causes hyponatremia, hypochloremia, as well as it's hyponatremia. These are all the main side effect of the loop diuretics. So next, so this is the loop. It's block the sodium chloride and potassium symport. So it prevents the reabsorption of these ions. Next. So main functions of loop diuretic is preferably it act as a diuretic, the primary drug of choice for hypertension. It used for congestive heart failure and pulmonary hypertension, etc. The main side effect of that loop. Next one. So the main side effect of the congestive heart failure, pulmonary hypertension. Next, main side effect is hypokalemia. It is also sulfur containing compound, so they have a high chances for hypersensitivity reaction. Mainly it cause hypokalemia. Next, diazide diuretic. So preferably diazide diuretic. It's main diazide diuretic and diazide-like diuretic. Both of them it's acting on distal convoluted tubules. So the main mechanism is it's block the sodium and chloride symport. So it's prevent the reabsorption of sodium and chloride in the renal tubules, and maximum these are two ions it's excreted through urine. So next, it's also preferably drug of choice for hypertensive drug. It is also having sulfur containing compound. They have increased chances for hypersensitivity reaction. Apart from diazide diuretic, it will cause hyperglycemia. So it's alter our sugar, increases the sugar level. So it's the main area is that diabetic patients should avoid the diazide diuretics. The last one, there is the third one, there is a spironolactone. It's otherwise called as aldosterone antagonist, or otherwise we call as potassium sparing diuretics. So it is a main mechanism of spironolactone. It is a main mechanism of action. Normally the spironolactone it's bind on the kidney, mainly aldosterone receptor antagonist. It block the aldosterone and it prevent the aldosterone induced protein, and it block the reabsorption of the H plus ions and more excretion of H plus ions through urine. That main side effect of this spironolactone they have a cyclopentanoperhydrophenanthrin ring. That's why it's cause it's mimic to it action, it's mimic to that of estrogen. That's why it will main side effect is gynecomastia. So gynecomastia, nothing but it is a breast enlargement in the males. It is a main side effect of this spironolactone. Apart from it induced hyperkalemia. These two are main side effect of the spironolactone. So those are not go for sulfur drug allergy patients. Preferably we go with this spironolactone because first two diuretics, that is a diazide diuretic and furosemide, both of them it will cause sulfur containing compound. They have increased chances for allergy. So the patients are allergic to sulfur drug, preferably they go with the spironolactone. Next, this 3 is the main diuretic. It's preferably used as a diuretic. Remaining is all adjuvant diuretics. Preferably it is not used as an diuretics. The first one, that is an next weak diuretics. From that first one is osmotic diuretic. Main important mannitol. Mannitol, it is nothing but it's artificial sugar. It is used for the diabetic patients for oral route, but here it is only available as bolus. There is a large volume of parenterals is administered, preferably for cerebral edema. It osmotically retain the water in our blood circulation and promote the excretion of the water through urine. So it's preferably used as a decreasing the cerebral pressure and cerebral edema patients. They preferably we go with the mannitol. It is available as bolus, IV bolus. Next one, acetazolamide. There is a carbonic acid, carbonic anhydrase inhibitor, acetazolamide. That it's preferably to block carbonic anhydrase and it prevent the conversion of bicarbonate to H plus H2O plus CO2. So it's prevent the reabsorption of the water, but it's not preferably used as a diuretic. It's preferably used for the treatment of glaucoma, that it decreases the intraocular pressure. So these are all diuretics. That overall, that first 3 category of diuretics: loop diuretic, diazide diuretic, and spironolactone. There is a potassium sparing diuretic. These 3 is preferably used as a antihypertensive drug. Remaining 3 only preferably used as a diuretic. Congestive heart failure, it used for congestive heart failure and acute renal failure patients. But remaining 2 adjuvant diuretics, preferably mannitol we use it for cerebral edema. Another one, acetazolamide, it used for the treatment of glaucoma. So there is a individual side effects and uses of the individual diuretics.